And we're back.
We're back.
Been a while.
Yeah?
Yeah,
Yeah, it's been tough. Tough to get it
Well, I
together.
ran out of coffee.
Yeah, I did do that too.
But we got coffee now, and we're back. Before we start anything, we kind of want to say a disclaimer a little bit, because we're going to be talking about COVID vaccines today. And we just want to kind of say up front that, we're kind of going to tell you some information about it, because I am a nurse. I deal with COVID vaccines every day. Ever since this, I've been dealing with COVID for a year now itself. And so, but just the information is same information you can get out there. Just remember to consult your doctor before, if you have any, questions about whether you should or should not. Consult your own doctor and do your own research. Don't just take anyone's word for it. And that being said.
Yep. Okay.
Welcome.
So we wanted to talk about a few different things about the COVID vaccine. And some of the stuff we'd like to start with is there are a lot of questions that have come up about it. So
there's a lot. Look at this paper.
Is the COVID vaccine safe?
Is it safe? Define safe. They say it's safe. I mean, within the testings they've done of it, it's safe. You want to go long term? We don't know. It's brand new.
Yeah.
The type of vaccines primarily out right now are mRNA. Mm-hmm. The mRNA itself, that kind of way of doing things has been kind of played with in laboratories testing for about 10, 15 years or so, somewhere in there. And so it's not brand new technology. They feel it's safe, and then they were able to implement the COVID vaccine right into it. And so that's what's primarily out there right now. Yeah. Long-term safety, we won't know for sure. But it's like with any, if you remember back, in 2009 or so, when the H1N1, that was a very fast vaccine that was kicked out. Did not know long-term thing on it, but it's been 10, 11, 12 years now, and there was no, it seems to be safe. So you just hope that it is. The benefits off it, the COVID vaccine, the benefits look good.
Yeah.
So, I don't know if that answers your question fully, but
I think so.
Unfortunately, it's not a straight yes or no answer.
Is the COVID vaccine FDA approved?
No.
Yep.
It's FDA approval takes a very, very long time to do. And so it fits under the Emergency Act.
Yeah, and the FDA approval, it takes lots of hoops and paperwork
and jumping and swerving and things like that.
Yeah, lots of paperwork.
Yes.
And lots of time.
Yeah,
lots of testing.
Many gone trees.
And many gone trees.
Yeah, so no, it's not FDA approved. It's under the, I forget what it's called. It's like the EU L or something. There's initials for it, but anyway, it's the Emergency Act is what it fits under right now. And so I heard another vaccine starts with an A, just got approval, I believe, under the Emergency Act, and then Johnson & Johnson's looking for approval as well. So you got a few that's coming up. You're going to get more and more, obviously, but no, it's not FDA approved.
Yeah. And is the COVID vaccine live?
No.
Yeah.
No, it's not like your flu shots and things like that, or your other vaccines that some of them were live and some were, they're live but they've been toned way down, or they're not, whatever. No, it's not live vaccine.
Yeah, the description mRNA sounds really technical and doesn't really make much easy sense for somebody who's not already like a biologist or something.
Yeah, but basically what it's doing is it's a blueprint that they're putting in, and it's a blueprint for your body to make an antibody based upon the spike protein of the COVID.
Yeah, just the shape.
Yeah, pretty much.
So that you can make an antibody that fights that shape of
Yep.
virus.
Yeah. So the mRNA basically is they're just it's giving your body a blueprint to build it itself.
And is the COVID vaccine working?
Don't know yet. There's not enough people vaccinated.
Yeah,
to really know.
It's going to have to be time.
What's nice right now is the numbers are going down. Currently, now whether that'll continue, who knows? Right now the numbers are going down, so that's in our favor, and they're cranking out more vaccines. So laboratory tests show that it does, depending on the variant, there's different degrees of how much it protects. But right now, for the variants that's out there, each one of the main ones, Pfizer, Moderna, offers some kind of protection. Pfizer actually protects more against like the South African one than Moderna does, but they do offer some protection laboratory test-wise. So,
which gets back to, is the COVID vaccine effective? Which that's
in theory,
on the test, it should
we'll
be.
see as we go into the future.
And is the COVID vaccine yearly?
Well, who knows? Right now, I've seen, at least, I know Moderna for sure, and I believe there's been a few that say that look for probably at least a booster shot once a year for the next few years until they, get it under control. And the problem is who knows if the coronavirus keeps mutating and stays predominant like the flu or whatever, then you're going to see booster shots from here on out. If it dies off, goes away, like what's one like the old SARS that went through here, well, not through here but in Asia, I believe.
And did the H1N1 go away?
I'm not really... Well, yeah.
We don't talk about it much,
the H1N1 kind of died out, and then the regular flu one just stayed. And, I believe isn't it smallpox they quit vaccinating for? I mean, they did for a long, long time. Are they still doing smallpox?
Yeah.
Which one is it that they quit?
I don't know. Something maybe we should research.
Yeah, it's obviously one that I don't ever...
You don't ever see, so...
Don't ever see. Anyway, it's possible for it to go away, obviously. But, I mean, really, with all the variants out there, and you don't know.
Yeah.
It's a guess. No one really knows for sure. They're all just guessing.
It is weird is that where it's just being rolled out to just some of the population at first, it's kind of weird to think about how early we are in the vaccination stage. That it's just barely being sent out.
Yeah, it's just barely. Yeah. It's just barely.
It feels like they were talking about it for a long time. Goodness knows, in November, they were saying, anytime now, we're going to have this vaccine.
Well, that's funny because it wasn't very few months prior to that, they were saying, a vaccine's at least a year out, at least minimum a year. And then, this was really rolled out quick, obviously. And that's one of the things that scares people.
Yeah, scared people.
And because there's a lot of unknowns. So, yeah, it was scary. They're guessing as long as they go along and to the best they can. I don't know. Right now, like I said, for your question is they are talking about booster shots, at least for the next foreseeable few years.
You remember that Santa Claus movie where there was that machine that was making the toys and they sped it up and it made the toys really fast?
Oh, yeah.
And then it made the toys really, really badly because it's making... I think that's the image in people's minds when they think about this COVID vaccine.
Well, yeah, because how much did you hear about mRNA prior to this for a vaccine? Like you said, mRNA, if you heard about it, you're probably in some kind of school in biology or something like that and heard about it. Yeah. Other than that, it wasn't a term used widely
and then they just throw it around
media.
Like everybody's supposed to, like the lay person is supposed to understand what that means. They're like, yeah, it's mRNA. Yeah, okay.
Of course, I know exactly what that is.
That is. Yeah. Yeah, we talk about that all the time.
Yeah. Tattooed on the bottom of my hand. I know it so well. Yeah, so that makes it all scary because it's all brand new stuff all at once. And so it seems like, all of it's brand new and now a lot of people are
together.
Yeah, so it seems scary. Some of it isn't as new as you think it is.
Is the COVID vaccine available in Idaho?
Yep, absolutely. That happens to be where I'm at.
Yeah, in Idaho.
Yeah. I got both vaccines. just because I'm a hospital worker. So nurses, docs, all were your front line. They all got it first. Right now in Idaho, 65 and older can get it. And they're talking about April releasing its general, like everyone, opening it up.
And is it free?
Yes. The vaccine itself is free. Now, each individual place, doctor's office, whatever, has their own discretion whether they charge an administrative fee for it. That's totally different. But the vaccine itself is free.
And
Free!
What is the difference between the Covid Antigen test and the Covid Antibody test?
What? I have no idea.
No idea.
The antigen one, basically it's a nasal swab that they're doing to see whether you got COVID. We've been doing that. Well, heck, we started sometime last summer testing people, and it got really ramped up crazy. But yeah, the antigen test is just nasal swab, and depending on which one you get, it could be a 3 to 5 day test or a rapid, which is just like we can crank them out in 2 hours or less, a result from it. So that the antigens, the nasal swab one, your antibodies, a blood test.
And with the antigen test, when should you get that?
If you're going to get one, we've been telling people if they call us, let's say in the morning, and they just got, they woke up that morning with symptoms.
Yeah.
We try to get them to at least wait a day or so because we want those symptoms really built up. Or, the antigen one, it's if you get a positive, you're positive. Antigen one can come up with false negatives, and it's just because you really got to be displaying symptoms. The virus really got to be built up for it to grab it and register as a positive. So we try to get people a day or two.
And how long will that still show up as a positive?
Once you test positive?
Yeah.
They're saying about 3 months. 3 months you'll keep testing positive on antigen, and then it should start sloughing off. Now that isn't saying that you're positive truly contagious that whole time. It's you display symptoms. Typically we keep people out 10 days from the onset of symptoms.
And are you still doing that?
If they have not had the vaccine, yes.
Oh. Okay, because I was thinking that did change a bit, but I guess it's just...
Yeah, there's some things have changed. If you're full-blown and you got COVID, you are out for a while, and it's 10 days from the onset of symptoms. And then after that, you tend not to be contagious anymore. So we typically, as long as your symptoms are resolving, you don't have any fever for 24 hours, then we'd let you back into work, whatever. But you're still going to, if you went even 2 weeks after that and you feel fine, you're going to test positive. And you're going to keep doing that for about 3 months on an antigen test.
Okay. And for the antibody test, is that a finger prick to be able to pull the blood?
Not typically, no. No, we're drawing some blood up because we need to fill it,
like a big tube.
That big around is scary. No, just a regular.
Yeah.
Just a regular little tube. We need about, I think, about 3 mils what we're pulling. So
that's not much.
No.
Yeah, that's not even a teaspoon. And is the antibody test a rapid test?
The antibody?
Antibody. Does it go quickly to get your results back?
We get it in about 24 hours. Yeah.
That's not bad.
Yeah,
that's not like
bad.
the original COVID test.
No, the original one that was like 5 to 7 days out, sometimes a little more,
Yeah, that was crazy.
The antibody one, we can get results in 24 hours.
And is the antibody test covered by insurance?
The antibody one? I don't know for sure on that one. Mm-hmm. I know that if you work at the hospital, they'll pay it. You know, it's free to mm-hmm. people who work there. But other than that, I doubt it. I'm sure you'd have to pay something.
Yeah, might check with your employer. See if
you'd want to check with your employer, your insurance company, things like that. I know the antigen one, a lot of insurances were paying. Even Medicaid paid for some of the antigen tests to see if you had COVID, but not antibody.
Okay, so is the COVID antibody test worth it?
In my opinion, no.
Yeah.
No. It used to be. Mm-hmm. We used to, things changed so quick. And it's funny because this is it's been a year officially here in Idaho. It was the end of March. So we're coming up on 1 year that we've really been working COVID in this area. Mm-hmm. And in that year's time, it's just so every few weeks, it's like everything changes again. Everything changes.
All the rules change.
So at one time when there was just one variant, everyone a few months ago was like, oh yeah, antibodies the way to go and do your antibody tests. But then all of a sudden they come out and said, well, if you did have COVID off that one strain, the original strain, those antibodies really aren't going to help you on like the South African variant. So it's not as helpful. In fact, that won't help you at all. The vaccine actually gives you more protection than your original antibodies on that one, is what they're saying now. So now we hardly do the antibody tests. Occasionally, if someone needs it for, I don't know, they just say they need one for whatever reason, we'll run one, but we hardly run them now. But a few months ago, I was doing a few, probably a couple a day. Yeah. But not now. I haven't done one for probably 2 weeks. It just died off.
Yeah, maybe to do with the release of the vaccine as well.
Yeah, the vaccines really changed things hugely. Yeah.
So what was your experience getting the vaccine?
I cried a little bit. Yeah. No, it actually was...
I can see you crying with your description of it. I can see you like, please,
the second one?
Yeah.
Oh, but it wasn't the vaccine that was the problem. It was the guy that administered it. That's what was the problem. He was just weird giving the shot. Other than that, I got the Moderna one, so I got one and then another one 4 weeks later. And really, all I had is if someone pushed on my arm, it hurt. The first one especially, it would hurt. So it got sore enough that I couldn't lean against anything or it would hurt. Other than that, I had full range of motion without pain. And no, because they talk about some people will get symptoms like they're coming down with something like a flu or a cold. I had none of that. Mm-hmm. I had no fevers, nothing like that with the first one. The second one, they told me, well, since you didn't have any of those kind of symptoms with the first one, you're definitely going to have it with the second one. Yeah. For sure. I mean, I'm like, oh, great, whatever.
Yeah.
They gave me the shot. And I kept checking my arm because the first one, by night, I had a little bit of soreness because my niece punched me and I was like, ow, that kind of hurts. And then by the next day, I was super sore and it lasted 2-3 days. The second shot, I checked clear up until I went to bed. No soreness at all. Mm-hmm. I got up the next day. There was some soreness to touch, but not half as what it was with the first one. And again, no symptoms.
Yeah, I was expecting you to be real sick that next
morning.
I
was with the way they were telling me. They were like, oh yeah, you're definitely going to get it. Everyone's different. And I've noticed because where I work in employee health and everything, we see tons of calls about people getting vaccines. And they'll call us. Some people, there has been some people who experience cold-like symptoms coming on. Nothing extreme, but they just kind of feel like they're coming down with something. So they'll get a little lethargic, things like that. Some of them even run a fever for about 6 to 12 hours, somewhere in there. And then it just goes away. And it comes on quick and then goes away quick. Mm-hmm. That's what it seems to do. There's also been some people who, after they get the shot, develops what looks like a rash started on their arm, and some of them it'll go clear down. And what's odd is they'll get the shot, wherever, here, but that isn't where the rash is. The rash will be an inch or two below and then go down. And so it'll look like a rash, and that'll stick around for a few days and then go away. I didn't experience any of that.
So if they have a reaction, is that something that they normally need to go into the doctor for?
Well, it would depend on your reaction.
Yeah, true.
After you get the vaccine, it's always suggested with any vaccine to hang around the medical staff for 15 to 20 minutes.
Yeah, with any vaccine.
With any vaccine.
But they don't.
They don't normally. With the COVID one, they really are pushing that, so they really tell people, stick around just in case. Mm-hmm. And just to make sure nothing like anaphylactic or anything like that happens. What was that? Oh, probably my phone beeping. But anyway, just in case. But I haven't heard of any severe ones at our hospital at all. Like I said, the worst ones at our hospital was the rash. Mm-hmm.
And just feeling like nausea.
Coming down with something. Yeah, my nurse practitioner did experience, he felt like he was coming down with something, just a little bit, and then he had a little bit of nausea that went with it. Mm-hmm. Nothing that made him like vomit or anything like that. Mm-hmm. He just felt like that for about 12 hours.
I have to say, that would be, that would bother me.
It would be bothersome. I'd
be like, could I just please stop feeling this?
You get to the point where you're like, just let me puke and I'll feel better.
Yeah, please. I would be that.
Well, nausea would be terrible. That's one thing I was worried that I was going to get on the second one.
Yeah, I was worried because I was just thinking, you just can't go to work feeling like that. That's just not,
Oh, I'd have went to work. I'd have laid across my desk and just, I'm so sick. See what people said.
Yeah, it's just like, it's one of those, I don't know, you just got to kind of lay around and stuff when you're feeling like that. There's not anything you can do. Just.
Yeah, there's nothing.
So, it shouldn't last long, though. Like you said, his didn't last long.
No, his lasted about 12 hours. And he said it was like someone flipped a light switch. He was just kind of feeling a little down, a little icky. And then, boop, he felt great, fine. Yeah. And everything was good. And, so my experience with it, it was great as far as I got through it with no symptoms.
Yeah.
Which was really nice.
Probably not too uncommon either, because there's a lot of people, they said, that get COVID and have no symptoms. So
yeah. Well, I've seen a lot of, because I see a lot of people from different hospitals too. And, the hospitals especially is who's giving it to their staff. So a lot of your hospital staff is vaccinated. And I speak with a lot of them who, same thing, they went through it with absolutely no symptoms. But then you get some that have some symptoms. And then you get some who you're always going to have, especially on something where that's being mass put out there like that. Unfortunately, no matter how safe it is, you're always going to have a small population who is going to have adverse reaction to something. Yeah. But you can have that with peanuts.
I tell you, that's the first thing I think of is we still allow people to have peanuts because...
Yeah, but it is totally different. But the point is, and I'm not telling anyone to go get the vaccine or not to go get the vaccine. I believe that it's your choice. I think you should educate yourself as much as possible. Talk with hopefully you trust your physician. Talk to your physician.
Be truthful with your physician.
Yeah. Myself.
Have a good picture of your health.
Yeah, absolutely. Me, myself, I weighed everything I knew about the vaccine against my own health. One of the things that's, I'm overall pretty healthy. But I do have bad lungs. My lungs have been just damaged. I got asthma, you name it. So I get cold, flu, whatever, and immediately it hits my lungs. Immediately I'm on steroids for 2 weeks.
And sick longer sometimes.
Sometimes longer, and you're talking not just regular, obviously rescue inhalers, but then I'm on nebulizer treatments and everything else. I did not want to chance the COVID, where it was strictly could be a very serious respiratory illness. I didn't want to chance it. I know
when you get sick too, people get really worried that you are going to need some emergency care because you scare them about
I scare people.
Difficulty breathing.
Years ago, it's funny. Not
Yeah.
funny. Well, looking back, it's funny. When I was in clinicals, I had a mild cold. Like, I really didn't feel any other symptoms other than I couldn't breathe. Which is pretty. Well, I'm used to it.
Yeah.
But it doesn't sound very well. And I freaked an entire floor out that I was on. I was doing a clinical rotation years ago because I was in school doing a clinical rotation. And they literally thought I was going to drop dead on him and called my clinical instructor and said, "We can't have him here. He's just going to go down." Everything. I freaked him out.
Yeah.
Yeah. I had to
I know
leave.
It's happened more than once that people are just like, get some emergency attention.
And I wasn't even that
right.
bad that day.
Yeah.
I was if I'm not getting air, somebody's phone. How embarrassing.
Very
if I'm not getting air, I
embarrassing.
know if I'm not getting air. But I do sound really bad because my lungs just, But anyway, that's why it's one of the things, obviously, I weighed in on my decision to get the COVID vaccine. And so I did it for that reason. But I just think everyone don't fall into all the hype on Facebook or whatever.
Yeah.
Check your sources. I see so much stuff on Facebook like, "Oh, the COVID vaccine is sterilizing women."
Yeah.
Really?
Yeah.
What?
Check with your doctor and see if it's good for you.
Check with your doctor.
Get some reputable sources.
Yeah. For one, it hasn't been out long enough to even know what it's doing. It would do for pregnant women, really.
Yeah, I think, I don't know. Yeah, you're pregnant, you definitely check with your doctor. See if it's something you do right now. It's not completely tested for children yet, so I don't see it being something for pregnant ladies yet either. But check with your doctor. Yeah,
on all pregnancy, we're just telling them, we're referring them back to their doc. Go to your OBGYN, talk to them, and get guidance from them. And it's what I advise anyone.
Yeah, because you don't know.
Yeah, you don't know.
You don't know, if there's some interaction that's going to happen with some other medical concern that you have. Something your doctor would know. Hopefully, yeah. They'd be more likely to know than we would. We don't know everybody who's watching and what it is that they have as their concerns. We don't know. If you have any questions, though, about the COVID vaccine that I could maybe answer for you, leave a comment about it. I'd be happy to get, answer that question, whether it be video or just writing you back. I'd also be interested in hearing what kind of rumors you've heard about the COVID vaccine, because I've heard some really funny ones. And I've heard some weird ones. They're pretty entertaining. So if you want to share some of those in the comments, I think that'd be really fun. Yeah. Did we satisfy your list? Yes. Yep. I'm out of coffee. I'm out of coffee too. So we gotta go. So don't know how long we'll be gone again. Gotta find coffee. Absolutely. Well, it's good talking to you again. Yeah, good talking to you too. We should do it more often. Absolutely. Goodbye. Bye.